Hello, 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 and welcome to Nursing News You Can Use at 5, Nursing Business and News. I'm Tina Baxter, and I'm your host. Welcome to those of you that are on our Nurse Shark Academy page, those of you that are on our Baxter Professional Services page, and those of you that are seeing us on YouTube. Welcome. Thanks for hopping in. For today is April the 19th, 2023. Let's go ahead and get started because it's not bad of a news day, but there's some important topics that I want to get to. So let's jump right in. So our first affirmation: don't compare your life to others. There's no comparison between the sun and the moon. They shine when it's their time. Again, don't compare your life to others. There's no comparison between the sun and the moon. They shine when it's their time. Second affirmation: stop keeping track of the mistakes you've made. It's time to forgive yourself. Stop keeping track of the mistakes you've made. It's time to forgive yourself. And our last affirmation for today: the more you love yourself, the less nonsense you'll tolerate. The more you love yourself, the less nonsense you'll tolerate. And those are our affirmations for today from our Inspirational Daily Calendar by Lauren Dratch. Okay, so let's get into our What I Am Reading segment. And this is coming from the Emotional Intelligence in Nursing book by Estelle Codier. I got interested in this book a while ago when I was really looking at doing some emotional intelligence work and things like that. And I want to share this story that she put in her book. And I think it really ties in well when we talk about the power of influence. So if you haven't had a chance to check out our blog on the nursesharkacademy.biz or our LinkedIn page, take a look at our new blog post about the power of influence. And so this is something that really resonated with me because we're going to talk a little bit about that before we get into our new segment. So this is called Story Brain on the Pillow, Brains on the Pillow. With equal parts irreverence and resigned sadness, nurses in the trauma unit referred to this as a brains on the pillow situation. So I wanted to put a caveat here and a trigger warning for anyone. This does discuss um, someone attempting to take their life. So I want to put a trigger warning out there for that. And it can be pretty graphic. But I'm saying this because in the LinkedIn article that I posted, we are talking about that gallows humor, that dark humor that nurses and others in healthcare professions have. So I want you to hear this story because I think this is very apropos. So she goes on to say, a young man had shot himself in the head, an inoperable, unsurvivable, and catastrophic injury. If there was such a thing as a trauma hospice unit, he would have been in it. There was little but supportive care left for this man and his family. Many trauma injuries take place within the context of complex family stories, and this patient certainly had. This young man had told his friends and coworkers he was gay years before, but when he eventually came out to his immediate family, his mother rejected him roughly. Distraught, he returned home and shot himself. His mother now visited him daily. She was angry and loud, and she persistently criticized every aspect of her son's nursing care: the way the bed was made, failure to turn her son more frequently, the state of his nails, and when he had been bathed last. She was hostile, belligerent, and unreachable. She rejected any compassion or support from the staff. She listened to the physician reports every day wordlessly, lips clenched. But upon the nursing staff, she unleashed her wrath. Nothing penetrated her verbal wall of hostility, and the staff had begun to avoid her. A novice nurse orienting to the unit was assigned to assist in this patient's care. Early one day, she was unexpectedly accosted by the mother, already on a tirade. The novice nurse was completely thrown off balance. No education or experience had prepared her for the verbal onslaught. She blurted, "Do you know this is not your fault?" The patient's mother looked as if she had been slapped. She burst into tears and, sobbing uncontrollably, threw herself into the arms of the novice nurse. To the nurse's co-workers, the sight was unforgettable. The look on the stunned novice's face, looking at her co-workers over the sobbing woman's shoulder, patting her back wordlessly. This woman had not known her son's actions were not her fault. In fact, she was convinced they were, and she assumed the staff judged her harshly. In reality, her self-judgment and guilt were overwhelming. Much, much later, she would accept that while she would forever regret her actions, it had been her son's own decision to end his life. The novice's simple question was her first step on that long journey to healing. I loved the story because I think no one clued into what this mother was going through. She had had an argument with her son. They parted on bad terms. And so now she felt as if she was responsible for what happened to him and therefore having to displace this anger somewhere. Obviously, she took it out of the nearest target, which were the nurses, because she had to be able to control something. And for this novice nurse to let her know that it wasn't her fault, I thought that was pretty critical. I say that because on the article that I just written on LinkedIn and on our blog, I shared some stories about nurses that were getting into trouble. They were on TikTok. There was a set of nurses. I don't know if you saw this story, but there were a set of nurses and they were on TikTok doing a dance to the song SLUT me or something like that. Anyway, they were in the hospital in the unit using patient rooms and hospital equipment, making sexually suggestive dances to this song and I guess lip syncing or something to it. I haven't seen the video. I'm just going by the report. And then we have the story of the nurses that were telling what their icks were. So we had a couple of nurses that talked about a young man who unfortunately had another gunshot wound. I don't know how he got shot or what happened, but the nurse was complaining because this kid had a gunshot wound, but yet he was afraid of getting his blood drawn or getting a shot, getting an injection or having blood drawn. And so she was making fun of him, not saying his name or anything, but again, doing these things at work and involving patients and patient care. And just because you got a gaping wound, there's nothing you can do about the wound, but he can do something about you drawing blood from him, right? Again, is that control that you have. And then the labor and delivery nurses that were talking about their icks with some of their patients as well. And so these nurses have gotten disciplined, written up. Some have been let go of their positions. And I say this because we get on social media and, we all have this gallows humor, this dark humor that comes out as a self-protective mechanism. But we can't forget that emotional intelligence. And I think that's partially what's happening here is that these nurses acting out of their frustration or whatever have not looked at it from the patient perspective. And how would you feel if your son had been in an accident or been shot and your nurse is making fun of him because he's afraid of needles? I mean, you know, so those are those things that we talk about at the water cooler, but maybe not fit for social media, and maybe having that emotional intelligence to take a step back and say, this kid is already afraid. He's been through a horrendous experience, and now you want to inflict even more pain on him? So let's take a step back and look at those things and do our due diligence. So that's our leadership moment for today. I just thought I'd talk about this because our topic for this month has been the power of motivation, the power of influence is our latest article. So check it out, get a chance to watch, to read it. And so I wanted to bring that up. So let's get on into the news. So our first story comes from Skilled Nursing News. And this is just was done yesterday, so I thought I'd bring this up. It says access crisis unfolding. Nursing home operators advocates warn of dire effects from Biden's order on staffing. President Joe Biden's executive order that aims to implement minimal staffing standards and tie Medicare payments to staff retention drew frustration from nursing home industry operators and advocates who said that the well-meaning directives would likely compound the staffing crisis and lead to closures unless policies are aimed at resolving its root causes and not penalizing nursing homes. Without policies and solutions and funding that allows for better paying jobs in the sector, the White House position may not serve to improve the quality of care either, they argue. However, in signing the executive order on Tuesday afternoon, Biden said funding wasn't forthcoming. According to what's reported, it says the executive order doesn't require any new spending. It's about making sure taxpayers will get the best value for the investments they've already made. We're going to improve long-term care by strengthening staffing standards at nursing homes. And I've also instructed the Department of Health and Human Services to figure out how home care workers can get the pay they deserve with the money already allocated. So again, this was in a briefing by President Biden when he signed this executive order. So funding for his executive order, which includes 50 different directives to federal agencies to address affordability and quality of child care, long-term care for aging and disabled adults, and job quality of the care workforce, will come from existing resources such as the American Rescue Plan. Those will also help states expand and strengthen Medicaid home care programs, according to Biden in his speech. So we'll have to see what happens with this. There's a White House fact sheet that has been published that you can definitely access. And so these are some of the things that are coming up, and we knew this was coming. I have to say, I don't know why nursing homes are surprised, because they knew this was coming. They've been talking about this for at least a year, if not more. So we'll see what happens. There's concerns because, as we've previously reported, there's been several facilities, nursing home facilities, that had to close because of lack of funding and the resources and staffing. So we'll see what happens, the outcome of this. So I just wanted to bring this up and let you know. So this brings us to our next story, coming out of New York. And this is just a really brief update, but there's attorney generals, and they're across the United States. There's like 18. So there's California, New York, etc., that are all involved in this. And it says New York Attorney General Letitia James is the co-lead in a coalition of 18 attorneys general and the inspector general of the District of Columbia who support a proposal rule by the U.S. Department of Health and Human Services and the Centers for Medicare and Medicaid Services that would require the disclosure of certain ownership, managerial, and other information regarding nursing home facilities, particularly from private equity investors and real estate investment trusts. In their letter supporting the proposed rule, the attorneys general said that the quality of care at for-profit nursing facilities, especially those owned and or operated by private equity investors, is often inferior to the services offered at nonprofit facilities. They cited a recent study that found higher short-term mortality, elevated use of antipsychotropic medications, fewer nurses, and worsening mobility of residents at the for-profit facilities. So again, this is coming from 18. This is not just New York, not just Washington, not just California, but 18 attorneys general across the nation have come together for this coalition. And so we'll see what happens out of this. Again, I've always argued for better transparency in these organizations, because we've talked about tracing the funding in long-term care and where the money goes and who gets the money and how it's divvied up and things like that. And so what ends up happening is, because they're paying all these different entities, a lot of times, which are often owned by the parent company, you're not seeing that reinvestment into the buildings, the staff, wage increases, and things like that can happen. All right, let's move on. Let's talk about, let's go to San Diego real quick. We'll get to this article. This is from San Diego. And it's talking about hospitals navigate nursing shortages and risks of closing. From a shortage of nurses to hospitals in danger of closing, the healthcare industry is getting hit hard. And we've certainly seen that and talked about that there is a lot going on in healthcare, and not to be alarmist or scare anyone, but we need to make sure that we keep an eye on what's happening. We've seen where hospitals are closing down, nursing homes are closing down, and oftentimes they're in the most vulnerable areas is where a lot of these hospitals and practices are closing. It says hospitals are getting creative to navigate these challenging times. One hospital is throwing big bucks at the crisis. Palomar Hospital is now offering a $100,000 incentive over a 3-year period to recruit and retain nurses. Palomar Health CEO Diane Hansen has said it's also an opportunity for us to hire some of the best nurses, maybe in the region or across the country, by offering them $100,000 over 3 years. It's part of an effort to attract and keep talent as the nation deals with a nursing shortage. Hansen says, with the pandemic, a lot of nurses exited the profession, whether it was from burnout from working so hard during the pandemic or people just choosing to retire. Another report has said that 1 in 5 California hospitals are in danger of closing because they are losing billions. Now, we have also talked about the fact that Ascension Healthcare has lost billions as well. So this is one of those things that it's across the board. It's not just in one state, but it affects a lot of different states. David Simon with the California Hospital Association says, you will see is as an erosion of healthcare. That is reduced services. One of the first services that is often cut is maternity care, and this can lead to things like care deserts. The California Hospital Association says Medicare and Medi-Cal patients are their biggest concern because hospitals only get reimbursed 74 to 75% for the costs of their care. So again, these are some of those issues about getting funding, possible closures. So this is a news article from Fox 5 in San Diego. Says they've reached out to several nursing organizations, but they have yet to hear back. Meanwhile, the governor's office says they are working with the hospital association and other places to do something about this. So we'll see what happens. But just as other places in the nation go, so you can see local things happening to you. So it gets closer and closer. Let's talk about this story, and then we'll move on to some stories about nursing schools. So this happens to be a story that came off of the Dow Jones Newswire, and it is about Brazil. Now, why am I talking about Brazil? It's because I want to demonstrate that it's not just here in the United States that we're having these issues in nursing, but it is across the world, and other places are talking about these very same issues. So it says Hapvida shares fall 5% after nursing salary bill sent to Congress. Brazilian healthcare services provider Hapvida I can't pronounce it. Investments shares fell 5% after Brazil's government sent a bill to Congress that would allow a minimum salary for nurses to take effect. So this is what's happening, is that they want to raise the minimum salary for public nurses that are working for the government. However, you have to offset that then with the current climate with the hospitals, etc. So it says shares reached 2.28 reais, the equivalent of 45 cents, and are down 53% from the end of last year through Tuesday's close. So the stocks dropped by 1.9% mid-morning during trading. The administration of Brazilian President Luiz Inácio Lula da Silva on Tuesday sent a bill to Congress providing funding for the setting a national minimum salary for nurses employed by the public health care system. The minimum salary would also apply to nurses employed in the private sector. The law establishing the minimum was approved last year, but Brazil's federal Supreme Court suspended it until the government provided funding for the salary increases provided by the legislation. So you can see this is just, again, not an issue just in the US. Other places in the world are feeling the pinch. And so that's where we need to gain some perspective and see where we are. So let's talk about this one because this is close to home. We went all the way to Brazil. Now we're coming right back to good old Indiana. This was published by the Indy Star. And this is an article that says, Fly with the Angels, nurse who removed COVID-19 patient's oxygen mask pleads to felony. An Indiana nurse accused of removing a COVID-19 patient's oxygen at a poorly staffed nursing home has pleaded guilty to a felony, but will receive no jail time. Connie Sneed, 54, of New Albany, pleaded guilty Thursday in Clark Circuit Court to knowingly or intentionally acting as a physician's assistant without a license, a level 6 felony. Under the plea deal, she received a suspended sentence of 540 days, which means she won't serve jail time as long as she stays out of trouble. She did not return calls to Indy Star. She was a licensed practical nurse at Wedgewood Healthcare Center in Clarksville when she drew attention from authorities from what prosecutors called, quote, a brazen Facebook post. Yet again, think before you post. Okay. So in the post, Sneed said she asked the patient if he wanted her to remove his oxygen mask so he could, quote, fly with the angels. She described it as, quote, the hardest thing I've ever done in 28 years. The patient, James Godfrey, 72, died on April 30th, 2020, hours after his oxygen was unhooked. He had been a resident at the nursing home for more than a month. His medical conditions included dementia and occasional depression. Sneed was initially charged in March of 2021 with practicing medicine without a license, a level 5 felony that carries a penalty up to 6 years in prison. The charge was admitted to a lower level felony as part of Sneed's plea deal with Clark County prosecutors. Clark County prosecutor Jeremy Mull said in an email to Indy Star that it was important to him that Sneed be convicted of a felony given the gravity of her actions. But he said other factors favored a sentence without prison time, including Sneed's belief that she was helping a suffering patient, her distinguished record as a nurse, and her acceptance of responsibility. The plea deal also allowed the case to be resolved without putting the deceased patient's family through a lengthy trial. It says, further in the article, it says, in an interview with state health inspectors a few days after Godfrey's death, Sneed confirmed that she had removed the resident's oxygen. She said that she had a terrible week and was caring for more than 40 COVID-19 patients at the facility when she forgot to notify the resident's physician of his decline. Sneed also told inspectors that the resident's daughter had told her, quote, if it was her father's wishes, she could remove the mask. Going into the pandemic, Wedgewood had the lowest possible staffing rating from federal regulators, quote, much below average, and was in the bottom 15% for total staffing nationally. It remains poorly rated. The nursing home was among the facilities hit particularly hard by the virus. At least 80 residents contracted the coronavirus and 22 died, according to state health data. So I'm going to say that this was a really sad case. It's a shame that the nurse didn't get an order from the physician there could have been all kinds of comfort measures that could have happened for this patient. She pleaded guilty, but again, this is my point. Stay off social media when it comes to things like this. Don't put stuff like this on social media. I don't advocate you doing things like this because obviously that was out of her scope of practice. But don't put stuff on social media. So that's why I brought this story up, is because it's another case of putting inappropriate things on social media. All right, let's move on. Okay, let's get to our next story, and this is coming again. This is from Bay State College, and this is a shame. This is another instance of a nursing school that's closing, and it's causing disruption in students in the students' um, care classroom. Sorry. It says as Bay State College collapses, students feel abandoned. All right. And it says it's been a season of setbacks for Bay State College, Massachusetts' last standing 4-year for profit college. First, it lost its accreditation. Then its landlord threatened the school with eviction. And most recently, there's been a sudden change in leadership. It will take drastic intervention to prevent Bay State from closing at the end of August, especially after losing its appeal of the New England Commission of Higher Education's decision to rescind the school's accreditation, which was based on financial and enrollment issues. News of the college's demise has left dozens of students reeling and disrupted their paths to new careers. Some nursing students said they were especially taken aback by the news because they felt that they had been thriving at the school. That feeling is accompanied by financial costs. And I want to say, we certainly went through the same thing here in Indiana when Harrison College closed. We had those issues happening, those students being displaced. And so I feel for them. Then students that were going to ITT and other places. So Indiana is, we've had some issues with the for-profit systems here, colleges here. So let's go on with the story. It says in 2021, the average price attending Bay State College was over $36,500 a year. In some cases, as when nursing credits are hard to transfer, that may be money wasted. Bay State College is a 77-year-old institution set up on the second floor of a Back Bay high rise. To many of its staff and student body, it felt a bit like a community college with its small classes and vocational mindset. Jeremy Shepard, the college's dean of students, says the typical Bay student is very career focused. Students may have tried other schools that weren't a fit, and they come here and they find their passion, their niche, and they want to turn that into their profession, he said. Despite the warning signs, it has been painful for Shepard, a 12-year administrator at the college, to watch the school unravel over the course of the past few months. So, according to this, it says the institution, which as recently as 2015 enrolled over 1,500 students, has been struggling for a while. In 2017, the college was sold to Ambo Education, an educational support services firm in China, in 2017, but enrollment already in decline never recovered. In 2022, Bay State had about a third as many students as it did just 3 years earlier. The college did not provide up-to-date enrollment for this spring, but amid its troubles, Bay State has some success stories, such as a rigorous, well-regarded nursing program. Cheryl McErney, who ran the college's nursing program from 2015 until just last year, said the program's courses were difficult for a reason. She says, I tell students all the time we have people's lives in our hands, so the rigor has to be there. The program is a small but important pipeline for health equity, McErney said, with many graduates going on to work at area hospitals. At about half of the program students spread out between Bay State's Boston campus and another in Taunton, which is also on track to close, are people of color. It isn't uncommon to find parents and military veterans enrolled in classes. The program took pride in students' high average scores on the nursing NCLEX exam, as well as its job placement rate. About 97% of graduates landed nursing jobs within 2 years or entered more advanced degree programs. So it sounds like this was they were doing a great job. It's just their numbers are low. And I'm not exactly sure why their accreditation was revoked. And so it looks like their interim president, Jeff Mason, resigned this month. So that leaves them with their new interim president, Kevin Derivin. So hopefully they can do something to bring this back together. I would hate to see that these students lose out on their valuable education. And we would certainly hate to lose these students, these nurses, potential new nurses. So that's very sad to hear. But it's kind of hard all over, and student enrollment has been down in a lot of places. And part of it, I think, is cost, cost and the high cost of living and all the things that are happening. So I always like to end on a positive note. So let's talk about our nurse making a difference. This is coming from Yahoo News, coming out of WX. I don't know. It says It says, meet the woman helping Detroit students learn more about nursing and growing their interest. So WXYZ Detroit videos, it says, quote, you may have heard this phrase, you have to see it to be it. It highlights the importance of early career exposure, allowing kids to see themselves in roles and help them understand what it takes to achieve those ambitions. That's what one local nurse is doing and trying to get more people into the nursing field. So in Detroit, she's reaching out to kids as young as 6 years old and kicking off National Nurses Week by showing them a career in healthcare is within their reach. Taria Nurse T. Alexander says, nursing is not my job. I feel nursing is my calling. And so I want to say congratulations to Nurse T. And you are this week's nurse making a difference. And I think she's doing a wonderful job. Okay, so that closes all of our news out for today. So let's talk about a few things that we have on the calendar that's coming up, right? So this year for Nurses Week, and you'll be seeing the promos go out hopefully by the weekend, but no sooner than that. I wanted to have something for nurses that are interested in kingdom entrepreneurship. And what do I mean by that? I mean bringing back those principles that we need to have and putting God first in our lives and God first in our careers. And so we're going to talk about that. And so for Nurses Week, we're going to have our Nurses for the Kingdom Challenge. So look forward to that. There'll be more information coming out. We are going to actually live stream this on Facebook and LinkedIn for the first time. So we're going to do 2 live streams, Facebook and LinkedIn. And we're also going to do this for 2 days. Originally it was going to be for 3. But something else is happening good on Nurses Week. So I will actually not be able to do the 3rd day on that Friday, but we may do an all-day workshop later on, is because they're having a nurse practitioner event here in the city of Anderson, and I am one of the honorees, and so I will be there for that. So thanks to Convergence Health and to all A-Town Productions who are putting this on. So I want to say thank you to them for doing that. So that's what's coming up. Later on this week, we'll have some more great things happening. I'm so excited for all the things that are happening. We'll have our next podcast episode will be coming out soon. We also have Baxter Professional Services. We are the hosts for a networking event that will be on the 26th. And that is on Alignable. So if you want to join that event, hop on Alignable, join in our Anderson Alliance on Alignable. And we're the hosts for that. And that will be at 12 noon. So you can sign up for, if you don't have an account with Alignable, I suggest you get one because it's great for growing your small business and talking to your neighbors that are right here in town and getting to know other businesses in the area. So this is a great way to get to know more businesses. So we have that coming up as well. And then, so that will be on the 26th at noon. We have our basic life support class. So if you still need to get your CPR class, the 26th is the time to get signed up because I will not be available after that. We will be closed the 27th and the 28th, and we won't be back until the following week because we're going to the American Association of Legal Nurse Consultants conference in Kentucky. So we will not be here. So the 26th is the last day to get your BLS CPR and also to get your TB class. So if you need a TB class, get signed up, get registered, let me know. Get in. You can give us a call, 765-387-8046 if you need to call and get registered. But get registered for the training classes because that will be it for the month. So we have that going on as well. And then don't forget that on April the 24th, we should have our next podcast episode going out. So be sure to tune into our podcast. You can get it on our podcast, the Nurse Shark Academy Show on Podbean, or you can go to our website, the nursesharkacademy.biz, and get our podcast, or anywhere you get your podcast, including Apple, Spotify, Amazon, etc. And don't forget, we have our YouTube channel as well, the Nurse Shark Academy. So you can hop on over to our YouTube channel and get the podcast there. Thank you for tuning in. Thank you for being with us today. Look forward to talking to you next week, and have a great day.